My grandmother's blood sugar got so dangerously low that she fainted. She ended up in the hospital and eventually she passed away, all because her medications ended up doing her more harm than good. And in this particular situation, I bring this up because we all know an older individual who's on multiple medications. They may have a caregiver or they may be caring for their medications themselves. And they're trying to do all the right things. They're trying to reach the goals that their physicians have set out for them, and everything that they're supposed to do. But sometimes the mark is being missed. And in my grandmother's case, it wasn't really the medication that was harmful, it was the way that she was using the medication. And unfortunately, I wish I knew what all was happening then that I found out after the case, but she had taken her insulin and not taken the right amount of food with it. And so, as we know, even the best medication can be harmful if not used appropriately or managed appropriately. So, in this video, I want to talk about specifically in older adults how we have gotten into this pattern of requiring stringent doses or stringent goals that may not really fit them. There in the past have been a lot of data to support that, but thankfully now we are kind of shifting from that. Before we get started, I want to say my name is Dr. Takova Wallace-Gay. I am the community's pharmacist. And on this channel, I want to make medications make sense to hopefully take you from confusion about your medications into clarity about medications. So if that's you, if that's somebody you know, or if that's a caregiver that you're aware of, please don't hesitate to hit that button, subscribe, and follow along for more information about how to make these medications make sense. So I really want to start off in this video with talking about the standard of tightly controlling certain things. And I'm going to talk a lot about blood pressure and blood sugar in the video as the top two examples, just because I think those are two of the more common ones, but it's certainly not the only situations that we find ourselves pushing for these really stringent or really strict goals. But to start off, I'll say for many, many years, doctors, pharmacists, nurses, we were all looking for the perfect numbers when it came to blood sugar, when it came to blood pressure, all of that. And the idea was really simple in that the lower your numbers are, the more the more healthful you'll be. The closer we can get it to normal, the healthier that you would be. The fewer complications or fewer risks that you would have. And some of those risks include things like kidney problems, eye problems, heart problems. And so we really felt that we were avoiding those things by getting you to the lowest goals possible. But the problem is that what might be safe for someone who is 40 may not be safe for someone who is 80. And in the context of this video, when I talk about older adults, I'm mostly talking about individuals who are 65 years of age or older. There are some nuanced situations where we talk about 50 and older, but for the most part, it's 65 and older. And so, of course, like if you're 40, you don't have a lot of medical conditions, the way that we manage your high blood pressure might be, and then oftentimes should be, different than the way we manage someone's blood pressure that may be 75 years old and have some other chronic medical conditions that we are managing. So what we know is that what we now know and kind of are shifting back to, because we've gone back and forth, is that if we are too aggressive with older adults, sometimes being aggressive like that might the risk might outweigh the benefits. And so obviously we don't want that. So I give the example here, diabetes. So pushing the blood sugar too low, especially if people are on things like insulin, like my grandmother was, or sulfonylureas, things like glipizide or glyburide, which my grandmother was also on. This can increase the risk of having dangerously low levels. And when I teach this topic, I tell my students all the time, a low blood sugar will put you in the hospital faster than a high blood sugar. We need to manage them both, but we need to be aware of them both. And so dangerous lows can lead to fainting, falls, ER visits, and in some situations can lead to death just because you're not getting enough glucose, enough sugar to the body to help it function. When we think about high blood pressure, driving that blood pressure too low can lead to dizziness, kidney injury, fainting again in this case, and it's just due to not having enough blood flow throughout the body, which can also lead to strokes. And so it really is a balance between, what's too high, what's too low, and what's a good level. And we have standards for that, but we really need to be looking at what makes sense for you. And partly what we do is we look at some of these clinical studies and see, well, what was the main population of patients or participants in the study? What was their age range? Because the recommendations that come from that are mostly going to make sense for that population of people. So, with that in mind, I'm going to talk about some of the red flags or some of the things to look out for. So, for most people, we recommend an A1C, which is that number that we look at in diabetes. We recommend that to be less than 7%. Well, again, if you're someone who has multiple medical conditions or you're an older individual, older than 65, there may be situations where we're okay with that number being just less than 7.5 or just less than 8. For most individuals with high blood pressure, we look for their blood pressure to be less than 130/80. But again, maybe you've got a lot going on and we're okay with it being just a slightly higher than. So it really just depends. And these are conversations that you have to have with your provider, that person that has seen your labs and seen your levels. You need to be checking your blood sugar, your blood pressure, whatever management thing at home. And if you're a caregiver, just keeping a very close eye on the person that you're caring for to see if they are exhibiting any signs of maybe their medications are overdoing it for them. So some of those signs that you can look out for, some of those red flags are things like frequent dizzy spells or falls. I have a really close neighbor here who's like a family member now, and I've been going over and checking on his medications. I'm actually really good friends with his primary care provider, although we don't work in the same clinic. And he goes to her, but he also goes to VA providers. And so the issue is that, like, he may get a medication from the VA and then get a medication from his local PCP, and the doses are different, or not the doses, the tablet strengths are different. So then he's all confused at home. He's been dealing a lot with dizziness that has been diagnosed as vertigo, which perhaps he's having some vertigo. I don't know, but I also feel like his medications are overworking. For example, I looked at his he does keep a log every day, so pretty much every day. So he knows what his blood pressure is, he knows what his blood sugar is, and he knows what his heart rate is. So I'm looking at his heart rate over the past week or so, and it's been running in the 50s for a lot of days. He had some that were like low 60s, but I mean, he's at 54, 55, and I mean, he's 80 years old. He's almost 80. And so looking at that, I'm like, well, you're on a medication that slows your heart rate. Perhaps your dose is too high for that, because he's on quite a lofty dose of this heart rate lowering medication. And so just kind of looking at those things and giving him some things that he and his wife, who's his caregiver and helps him kind of keep track of things, that they can talk to their provider about at the next visit. And then I will usually provide kind of some interim low risk things that he can do to maybe help mitigate that in the process. And so I say that to say, he's been having these dizzy spells that are either related to stress and or related to a medication issue. And just continuing to review those medications and look out for that is going to be really important. I talk a lot to people about building a medication map, which I have a whole system for, a whole guide for, that helps you just kind of see all of your medications and what the side effects of those medications are or can be. And then it also allows you to put your goals on there and some questions that you can ask. So if you want to look at this medication mind map, concept map, check the description box below. There's a link there where you can download that free guide. But really taking that med map and using that at least every other month, every 3 months, to review your medications, which is kind of the second step in like this bridge framework that I've developed, building your med map and then reviewing them regularly, because you may change from year to year after 3 or 5 years, and you may not need the same dose of medication A now that you needed 5 years ago. So it's really important to continue to check in on that so that you don't fall beneath or fall through the cracks in terms of certain conditions being fully managed and not just allowing medications to continue to go just because you've been on them. Okay, let me get back to what I want to talk about. So some other signs, some other red flags to look out for. If the blood sugar has been in the 60s, even 70s, low 70s, consistently, that might be something to watch out for, especially if that person that you're, if you or the person that you're caring for is on insulin or something like glipizide or glyburide, that's really important to watch out for. If they are taking a lot of blood pressure pills, but still feeling weak or dizzy or lightheaded, like their levels might be getting too low, or there may be just something going on there with the medications that could be adjusted. Maybe they're getting dehydrated if they're on a medication that gets rid of fluid. So again, just watching out for that. If it's someone who's been going to the ER or going to the doctor because they've been feeling confused or having some weakness or fainting spell, that's something obviously that's going to be really important to watch out for as well. So just keep all those things in mind. And so the things you can do about it, I already mentioned medication reviews, and I'll preach it, preach it, preach it. When you go to the doctor's office, they're going to say, are you still taking all these same medications, A, B, C, D, E, F, G? And a lot of times people are like, yep, still taking all the same things. But there really needs to be more of a conversation around it, especially if you're having symptoms about like what dose you're taking, where you're getting it from. Has anything else in your lifestyle changed that could now require a different dose of a medication? So really a more comprehensive med review would be great. So maybe your clinic has a pharmacist in it. That is what we're there for, is to really take the time and spend the time to do that. And so that's something that should be discussed. Maybe there's some deprescribing that needs to happen, meaning coming off some medications, stopping things, or reducing doses. And so I'm constantly looking for ways to take people off medications. If you're going to take them and you need to take them, I want you to be safe and use them appropriately. But I mean, if you don't need a drug, don't take it. And I don't say that to say just stop taking your medications, because please have a conversation before you do so. But there are some situations where you could potentially come off of a medication or reduce the dose of a medication if your situation has changed, or we come out with new drugs all the time. You may have been on an older drug that now there's something newer and better out, and we can stop that medication and put you on something different at a lower dose, or that may have lesser side effects. And so it's always worth reviewing in terms of like maybe deprescribing or modifying the prescribing of your medications. And then the biggest thing, they're all really important to me, but one of the bigger things is to really ask appropriate questions. And so you only get the answers to the questions that you ask in the way that you ask them. And so instead of saying, how low should my blood pressure be? You might say, what's a safe and realistic target for me? Knowing what you know about my age, my medical conditions, my kidney function, like all of that. So what is a safe and realistic target for me? So asking better questions. And I talk about this in terms of, guiding your healthcare team. We are here to be your advisors. You are the CEO of your body and of your health, but we're here to guide you. And so we need to be making sure that we're focused on what you find important at each visit, and then we'll help inform and advise you around that. That's our job. I mean, obviously we will find things and note things that you might not know to think about, but it oftentimes starts with asking the right questions to get the answers that you need. And these aren't difficult questions. It's just that you need to know to ask them. So again, one thing that you can ask is just, what's a safe and realistic goal for me? Rather than just saying, how low should it be, or are my numbers good? Be more specific with the questions. All right, the final thing I want to say here is that the perfect numbers, the numbers that our guideline documents tell us to go for, aren't always the best numbers for certain individuals, especially if you're over the age of 65 or if you have multiple chronic medical conditions. So if your loved one is older or falls into that multiple condition category, or on multiple medications, more than 5 or 6 medications, it's okay to ask, like, do I still need these meds? And what are the goals that are best suited for me? At the end of the day, the goal for us and for you really shouldn't just be about adding years to your life. It should be about adding life to your years. We want to do both. But while you're on these medications, I like to say, I want to take you from just surviving on medications to thriving with them, or I'll add this on, taking them off and thriving without them. But we have to do that safely and appropriately and with the right information in mind. So if this video has opened your eyes to to goals and things to look at and things to think about. Hopefully it has. I think the biggest thing is thinking about building your med map, reviewing your medications regularly, and asking about your goals and targets and what those look like specifically for you, knowing that, especially for an older individual, it may not be the same as someone who's 40. With that in mind, if you learned something here, please hit the subscribe button. Let me know in the comments box below if there's something that you want to hear about, or if you've come into a situation that you need or would like an answer to. I'm happy to accommodate, and really start with building that med map. I think that will help a lot with just strategizing and getting all your meds in the same place. So until next time, cheers to a better you, cheers to better meds, cheers to better health, and I'll see you in the next one.